You're Mickey, yes. You just introduce yourself, face the camera, and complain your problem. Then we start from here.
Okay, my name is Mickey. My major issue that I've been having is past probably 2-3 months. I've been having irregular menses. I actually pretty much had irregular menses since 19, and then a doctor put me on birth control pills for almost 10 years. And then I also had a ovarian cyst when I was on the pills, and they kept telling me that I had to keep taking the birth control pill to prevent it. But I just didn't want to take it anymore, so I just stopped it without talking to them. And then now when I go to see a gynecologist, they still tell me, like, why don't you get back on the birth control pill? So I don't want to. My irregular menses usually spotting. It started with when I was running. I run a lot. And when I was running, the only time I run, I was spotting. And then when I stopped running, and I stopped spotting. Then it started just constantly started to spot. And now for the past 2-3 months, I would have irregular menses, and I would have no menses for like 5 days or so, and then I would start spotting until my next cycle. So I'm like spotting a lot of time.
Constantly spotting, but not really a real...
Not a real blood. So it's just like a little spot.
In the color?
It really depends. Sometimes it's brownish red. Sometimes actually like pink, like a cut blood, red blood. Yeah. And I have a cramp sometimes here and there too, but mainly I have no symptom. It's just I have a spotting.
Let's see your tongue. Yeah. Also, the tongue slightly swollen, and the tip is very red. Do you sleep well at night?
Not lately.
Not. And do you eat sweets?
Sometimes I do.
Are you a sweet eater?
No, not really.
No. So okay, one more time. So this could be the heart heat, but it's not. It's not. It's from sleeping, not lack of sleep, and the swollen is tiredness. Why you're so tired? You work a lot?
I think it's from the stress, and also I start working out too. Maybe that's why.
Okay.
Yeah.
All right. And how's your bowel movement again?
Bowel movement's good.
The bowel movement is good.
Yeah.
But there is some issues here. It is a bowel movement issue. Tend to be constipated. Do you have that, or you don't feel that? Do you feel refreshed when you go? Or you feel like,
It's usually I actually get the loose stools when when my menstruation's off. Yeah, and sometimes do get constipation, but more towards the loose stools than a constipation.
But you never get like a rondelle, like a...
I did get it for a while too, like a pebble-like.
Pebble-like,
yes, I did.
Yeah, the pebble-like stool is a blood deficiency. It's a blood deficiency type of constipation. Yeah, I want to make sure that, because just from looking at you, there is a blood deficiency issue right there. And I don't know how you eat. That's another issue. Are you very picky?
No.
Eating? Or you eat
I
everything?
eat everything.
You eat everything. Oh, this is the pulse on the right side is pretty smooth. It's not that bad. But the left side, the yin side and blood side is weak. It's quite weak. The brownish period usually indicating stagnation, not enough blood to come out. And also this part is a little bit dark. That's spleen area, spleen and kidney area.
And my menses, when I actually have irregular menses, it started to get heavier than before. It used to be lighter, but now it's this 2, 3, 4th day, it's heavy. And then taper off. And then I would have that spotting the whole time afterward.
Okay, like that. Do you sleep enough, or you have hard time falling asleep?
I used to be able to fall asleep really easily. Now I have a hard time, and then I keep waking up.
You keep waking up. Do you have a lot of dreams?
Towards the end, I do, yes. Almost every night.
Almost every night. And what kind of dream? Is that very vivid or like figure?
Usually, it's pretty vivid that you can remember.
Yeah, and when you can remember, it's more like figure, like your friends or something.
It's
like
usually somebody that I know. Friends, families, work, co-workers, yeah.
It's more, it's okay. You seem to have, we have 3 types of insomnia. One is have hard time to fall asleep, which is liver issue, liver function. And the other one is keep waking up. Once waking up, have hard time falling back to sleep. That's a kidney issue. And then the third one is that disharmony of the digestion, which is you end up having quite vivid dream, especially figure. This is so interesting that it's not myth. It's the reality of the shape of the dream. That also documented in a classic book. And we can verify empirically from people, and also this type of dreams. So, okay.
Yeah.
Okay, this is this is definitely, because when I press right here, this is a spleen area. This is a Yang-Ming type. So the issue is more complicated than the like shoulder pain. Yeah. Okay. Look, she keep making face. I'm moving down. She keep making face. Yeah.
Esther, really quickly, how can you tell if the patient has sleeping problems?
Oh, because when I was looking at her tongue, the tip of tongue was quite red. So quite red, and then that could cause from the taste bud. Because taste eat too salty or too sweet. But then she said she wasn't really a sweet eater. But then I asked, because that's a hard yin deficiency. Hard yin deficiency could be from insomnia. That's why then help me to raise the next question. So I just pretty much when I ask question, there is a reason. It's good that people can ask, so I can elaborate more. And I listened to all the sign or symptom that she was talking about the brownish spot and spotting all the way, and no blood to come out to shed, menses. And she was using hormone, actually regulating it for some time. She doesn't want to do that, which in a way we all agree. Hopefully we could correct it, or from your diet, from your lifestyle, from your sleeping. Okay, you just, when we do that, we keep observing her facial expression, and because the body don't cheat. That's why it will just spontaneously do that. So I know this spleen level is having issues, and not just there, it's here as well, all the way. This is this line. And then now here, the navel. Okay, here, corresponding to the spleen. This is about 230. Okay, even 12 o'clock, go all the way. Yours is 12 to 2. Okay, see. It's a little bit easier here. Yeah. Similar hour. Okay, now comes to even 11 to 2 to 3. Now, I'm not done yet. Now this part, I check the spleen, stomach, still spleen, and comes to here, like stomach 25 area, and in and out this area, and though this is ascending colon, transverse colon, and those at the colon area, check for the constipation, bowel movement. We'll see. part is not bad. Nothing.
Yeah.
A little bit
It feels a little heavy.
more heavier this side, right?
Mhm.
Okay.
No,
That
no,
just
it's fine.
that shows this large intestines. Is even that she had bowel movement, but it's not that regular diarrhea or tend to be constipated. That has a little gem right here. So that's this. You are good to be the first one because this is the one I practice most in the clinic. But yesterday we had no patients. I've been, yeah, it was so interesting.
Are you palpating the spleen area because spleen is the mixed blood and she's blood deficient? Or
It's not just that,
Oh.
because the whole Master Tong's idea and the whole Chinese medicine, there's a huge school about the stomach and spleen. And so this actually is a essential issue of TCM. So that's why clinically I see so many people even manifest into different symptoms, including anxiety, insomnia, or even depression, or those are all related. So end up in a clinical practice, I use very simple point, down to the earth and down to the very basic. You want to say it as traditional point or Master Tong's point, it's okay. Master Tong's point, name it differently, up and down, or outside the traditional point, but it is the same meridian. It is the same issue. That's why no matter what, if we really take care of the issue on this part, we will help patient a lot. So it's more than that specific, Yes, her complaint fit into that whole body of thought. Yes. So when we do this area, I want you to very clearly when I say, because the only thing that could help us to determine where the issue is we can do the distal point. It's because the correspondent area. That's all this from spring 3 to 4. You will see, and I give you some other interesting clinical experience as well. Usually I started from like spleen 4 and I start to trace it. I trace it from spleen 4. Okay, already. Look at her face. So I don't want to say amusing. That's a little bit disrespectful. But it is that your body spontaneously reacts as such. So give me a secret. Sometimes they say, how do you know? I said, I'm looking, I'm watching, observing you. So this is a good candidate. Then we could go on a little bit. Sometimes it's more than just one spot. So this is from spleen 4, go all the way down to spleen 3. And her problem, apparently, is spleen 4. Then let's see how much it has covered. I hidden her. Okay, still here.
Yeah.
Now, still here, this is a little center. So, 灵龟八法, spleen 4 connect to which one?
PC6.
Okay, P6, yes.
I can take the red stuff.
Yeah, it's fine.
Are you sure?
It's fine. Oh, I need a finish.
Oh, do I have to raise it?
Oh,
oh,
so good. Thank you. The reason for then I end up wanting to at this point is because right in the center. And pericardial meridian is go this way. No.
Better less.
Less,
Mm.
less, but still some, right?
Yeah.
Mm-hmm. Now I'm gonna go all the way downwards, and this a little bit here as well. Okay, right?
Mm-hmm.
Oh, that center is still something going on, right? Is it better here?
Yeah, that's better.
This is better, but this is not yet, right? Okay. Lingui Bava, they actually cross right here. So sometimes when the issue is not done, I will add a Zhongwan. Now, when I say this and this Daoma, and this is the conducting point, at least in my thought. Now, again. Okay, softer. How you feel?
It's much less.
Much less.
Mm-hmm.
Now we want to deal with this area, from 11 to 12. Oh, to 1. To the all spring. We use that needle. Again, let me know if you feel sore here or the sore spot. Oh, okay, beginning to sense that, right? Okay. There's even more here. O'clock. 12. 1.
One is a little.
1 is still a little, right?
Yeah.
2.
That's
Okay.
fine.
It's fine. So, okay. Okay, sorry. Now again, 11, softer. 12. 12 was sensitive.
Mm-hmm.
It's better. 1,
That's fine.
fine. 2, fine.
Mm-hmm.
So this correlation, we want that necessity to happen. So it's not just I practice, you will get the effectiveness. When you do it, it will be the same. Otherwise, it's not knowledge.
So that's spleen 9 or shift
Yes.
1?
This is spleen 9. Because her issue, so much so, related to the spleen. Yeah, I just want people to tell me if you could think of next one. Foucault is a good choice, yes. Sometimes I go for liver 3, because that also is a 和穴. Okay, already, look at this lady. Because this one, I hate to say, modern people or people, human being in general, there is a strong issue of self-identity. So, and when that doesn't meet not other people's expectations, sometimes it doesn't meet our own expectation, then we're not happy about it. So I don't know why we're human as such. I have no idea. But then that's why liver 3.
But why the left versus the right lever 3?
This has no reason because her evil, her issue, it is the blood in level. It's more on the in level. 左边是 left side.
As Esther, are you able to explain the relationship between the areas of the abdominal palpation and your treatment location?
Yes, we repeat it one more time, okay? Now, this is the liver 3 that our candidate points. And the other one that your suggestion, we can test that one later, so we could go for even 7 points. Okay. Is this sore here? Not that. Oh, a little bit.
A little bit.
A little
but
bit
not
here.
that.
That's the Fuka. And besides the Fuka here, there's a 置物穴, because she had the control the. That's a Mr. Tung's point, to control the discharge. Some here. But this is the right side. We're gonna avoid. Even is on the arm, but let's get a small one and we put one more. Gynecological points. Just one. Issue one. This is the right place. A little bit.
It's a little bit high, more
Little-
distal, I think.
More distal.
Yeah.
Okay. Okay. Now, about the question. This whole area go all the way down, stomach here. So these are the area we palpate. Sternum here, right? We go under, starting this point. Because this is where the hiatal hernia usually happen, acid reflux. So we start here. Most of the time, people, it's okay right here. But when it comes to along the rib, again, Mr. Tung's point, even that you palpate along the rib bone. So I go all the way, usually starting this area, spleen area already. There's a whole area. This spleen area. The reason I say that is go all the way. I want to share it with you. Okay, sorry.
Just tickles.
Tickles.
What are you feeling for?
I'm feeling for her reaction.
Okay.
I'm looking, I did not, she could say it, she could say ouch, 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 all the way, but because I was looking, her expression, probably camera didn't catch that part, so they don't know, or you don't know, people don't know what I'm palpating about. It is, when I palpate, I look at the patient's reaction. And then, we know we go all the way to here, that's about 6 inches below the armpit. There's a 大包, yes. That is the big low, big junction point in this area. 大包 of spleen. And 大包, the junction to what? Junction to what? 大包 junction to what? 皮子大络为大包, 它 junction to lung, to 太阴呢. Foot 太阴 junction to hand 太阴. And the reason that it wants to have this junction is because this junction then could grab the essential qi. That's why I want to do the brief this morning, before to get the oxygen, so to process the food. So these are so crucial. This also is new. That last time I didn't have a chance to talk about it. The reason that spleen meridian is so important, it is a lonely organ, irrigating all over. But in the meridian book, if we read it, that's the part that I enjoy reading so much every time because I don't remember that much anymore. So I have to reread it and refresh my thought. So this spleen meridian connected to major 9 meridian, 9 other meridians. So this to junction to the lung. So nowadays, I sometimes will add one treatment to help this junction, is to make a cup suction right here. And I tell you, many people, it's purple. I assume that she will get that purpleness as well. We can do that later or not, we'll see. And then, now I still want to explain those. These pretty much this. And the other one, junction point, is stomach junction. Same stomach junction with the lung as well. 位置大络约虚里 His name is called 虚里 XULI 位置大络 called 虚里 It's also junction with essential point. And I assume, watch out. I assume that has connection with the 厥阴 liver meridian as well. Then we will see those parts when I have more information to talk about. Next is this navel area. Navel we palpate around the clock, just like we described yesterday. So we have an idea, at least we can document in our the patient's record. We know that from 11 to 2 was sensitive areas, especially 12 o'clock. And then we said the correlating point yesterday already talked about is spleen 9. So we will work on this part. But spleen 9 oriented to which, we could orient and make sure that every clock has been relieved. That's even one point with different depth and different orientation will deal with the issue. But from this area, the corresponding point is spleen 4. But even I say it's spleen 4, there is exception. I have a cancer patient who having bloatedness issue. And when people, after we eat, we tend to get bloatedness. It's all this issue. We have to deal with that. And her spleen 4 is fine. I was puzzled. Every time I go from spleen 4 back to spleen 3, seems to be quite healthy. So I know her body constitution is quite healthy. So the other day, I don't believe it, because this has been verified consistently, almost 100%. How come this patient had the symptoms, but not the thought that I was thinking it will go? But then, so I start with spleen 3. And then the problem is very subtle. Under the spleen 3, under it, there is a very, very sensitive spot right there. That sometimes when I go along, it's a little bit sloppy and I miss that. But end up, I start with spleen 3. Going backwards, all other spots are fine. But that specific spot, I insert that, all the problems disappear. Because we dig out the really issue. We find that spot. So don't give up. I've been testing a couple of times. I said, I don't believe it. So let me try reverse. We have to think out of the box sometimes. We have to think that our habitual thinking procedure may not be sufficient. So we have to think of that. So then for liver 3, the spleen 3 and liver 3, these are all source point. Source point is so powerful. That means even it's a yin meridian, but it has the original power of the quality. So liver 3, go directly all the way to the top, to Bai Hui, connects to Bai Hui. That's why we do this. And yesterday we talked about gynecological point is, corresponding point is breast. It's OBGYN points. 置物穴, there are many points, even 3 to 5. There's all kinds of discharge. The reason that I think of 置物穴 as another option is because the spotting brownish. Now look at her color here, slightly changed. The base is still dark. You need to have good night's sleep, then you will have the luster on your face. Otherwise, okay. So that's pretty much the plan, the needle plan. So, if more question about this location. I was hoping that, I was thinking, maybe I would do this all the time, do these points, spleen 4 and spleen 9 and liver 3. That's my clinic, the most used points.
I have a question. What are
Okay.
What are the corresponding points to each of the clock? For example, 1 o'clock is pain. If 1 o'clock is painful or hard, what does that mean, and what point would you use to release it?
Like 1 o'clock, all around it is a spleen issue.
So if there's any tenderness, you would needle a spleen point?
Yeah, a needle will needle spleen 9. Will needle spleen 9. But the depth of it and the orientation, then that means the level of the stagnation could be different, and we may not be able to do it all at once, but some area will be relieved.
How do you know what level to put the needle in correspondence to the...
In the beginning, I always go mesotones all the way down to the deep needle insertion. Then I start testing again. Testing, we know her condition is 11 o'clock is okay first time, but 12 o'clock still some. 1 o'clock, 2 o'clock is all better. So that 12 o'clock is still some. So I elevate up a little bit. I elevate up because we started deep. So we could go up a little bit and then test again. Yes, 12 o'clock was better after I uplifting.
So for any hardness or pain around the belly button at whatever clock point, you would put the needle in spleen 9 to
begin with.
make it easier for the needle to go in, as you mentioned yesterday.
Yes. And for this now, for this point, at this point, we don't even bother to needle here. So we choose other points. But for people, even with all those adjustments, they still have some hard point. We may go for that spot, or even using the opposite spot. We have options. Remember that that's not a one and only needles. So say if after this and 12 o'clock still pretty hard and so hard, I still have hard time needling it, I would choose the opposite. I would choose the 6 o'clock. Using the 6 o'clock more, it's not distal point. It's close, just next to it, and it's almost an ashi point. Ashi point is this. This is just next to the point. And because this one could control this one as well. Remember I said this is contradiction. This is the opposite point. Opposite point, it's going to counter this point. So if this is like one is summer, one is winter. So I use the winter point to control it. This is the opposite point to control. But if I could do it here, I could relax here as well. This is much looser right now.
Yeah.